Hello. Hello. Hi, Venu. Am I audible? Hi, Reddy.
Okay, fine. Okay, guys. Okay. So, you guys, please solve the question. Okay, these are very important questions. So, let us solve this question. So, first one, a 30-year-old female is having 15 square centimeter debridement performed on an infected ulcer with SCHAR on the right foot using sharp dissection. The ulcer were debrided all the way to down to the bone of the foot. The bone had to be minimally trimmed because of a sharp point at the end of the metatarsal. After debriding the area, there was a minimal bleeding because of very poor circulation of the foot. It seems that the toes next to ulcer may have some involvement and cultures were taken. So the area was dressed with sterile saline and dressing and when wrapped. What CPD code should be reported for this question? Everyone, please solve this question and drop your message. I mean, drop your answers in the comments. Yes, guys, everyone. Correct answer Rasna Rashi, Mohini, and Venu, Reddy, Jidin Narayana Swami. Correct answer, guys. Okay, actually, option C is the answer 11044. Okay, yeah, next is a big question, and also the answer is too long. A 64-year-old female who has multiple sclerosis fell from her walker and landed on a glass table. She lacerated her forehead, cheek, and chin, and the total length of these laceration was 6 centimeters. Her right arm and left leg had deep cuts measuring 5 centimeters on each extremity. Her right hand and foot had a total of 3 centimeter laceration. The ED physician repaired the laceration as follows. Forehead, cheek, chin had debridement of cleaning of glass debrides with the laceration being closed with one layer closure. The arm, the leg were repaired by layered. Okay. So the hand and foot were closed with adhesive strips. So select the appropriate procedure code for this visit. Hi Akash, correct answer Akash. Vanakkam. Actually, in these question papers, I'm sharing case studies question also, guys. Okay, so it will be more helpful for your CPC examination. Okay, Akash. Yes, Akash, very good. You are right. Option D is the answer. Super. Yeah, Rasna Rashi, correct answer, dear. D is the answer. Very good. Very good. Both of you, super. So, next question. Okay. Third one, an infant with a genu valgum is brought to the operating room to have a bilateral medial distal femur. Hemiepiphysiodesis is done on each knee. The C-arm was used to localize the growth plate, with the growth plate localized on incision was made medially on both sides. So this was taken down to the fascia, which was open. The periosteum was not open. The orthofix figure of 8 plate was placed and checked with X-ray. We then irrigated and closed the medial fascia with the serovicryl. The skin was closed with the 220 vicryl and 320 monocryl. So what is the procedure code is reported? Akash Venu, option D. Okay, so for this question, right? This question, present question is option D, right? 27485 modifier 15. Others, please drop your messages in the comment box. Yeah, correct answer. Akash, correct. Akash and also the Venu, both of you are correct, guys. Very good. Yeah, Mohini Patel, correct answer, dear. Okay, so let us check the next one. Is it visible, guys? I know it is. Yeah. A patient is a 67-year-old gentleman with metastatic colon cancer recently operated on for a brain metastasis. Now, for placement of an infused airport of continued chemotherapy, the left subclavian vein was located with a needle and a guide wire placed. This was confirmed to be proper. Fluoroscopy transverse incision was made just inferior to the and subcutaneous pocket created just inferior to this. After tunneling, the introducer was placed on the guide wire and the power port line was placed into the introducer and introducer was peeled away. The tip was placed in the appropriate position under fluoroscopic guidance and the catheter trimmed to the appropriate length and secured to the power port device. The locking mechanism was fully engaged. It was secured to the underlines of tissue to silk stitch. What's the code is reported for this procedure? Yeah, Rasna, the previous question answer is the correct answer, dear. But this question is very difficult to find. I know, dear. But please adjust yourself because it's a long question. So it's not visible. Yeah, I know, dear. Just skip this question, okay? Let us check the another one because the question is too long and it is visible in two separate pages. So that is why the limitation is there. Yeah, so this question, Akash, actually that question is not visible. So that is why I'm skip with that question. Hi, Bindu. Catheter. Okay. Yeah, catheter A is inserted, so it become option A. 32557 is the answer. Venu correct answer dear, and Mohini also correct. Akash, yeah. Okay, correct. Rasna, please check the code. Next, Rasna, Jitin, option D. Okay. And what about others? Rasna, Jitin saying option D. Option D for 49592. What about others? Is it incarcerated or strangulated? Ah, how to identify incarcerated and incarcerated code? Incarcerated means to identify it's a symptoms is involved or a asymptomatic condition. Already I discussed in my 10 day CPC class. Symptomatic is considered as incarcerated, Akash. Symptoms is involved. You can take incarcerated code. Very good, Rasna and Jidin Narayana Swami. Okay, your right answer is right. Already I told in my special classes, symptomatic condition is considered as incarcerated. Don't don't be too confused. Oh, this also in 2 pages. Yeah, solve this question. Next one. Any C for this question? C 44960. Rasna A, Akash A, 44970. Okay, what about others? Please drop your comments in the your answers in the comment box, guys, because this question is very important. Rasna and Akash, you are right. Option A is the answer for this question. Okay, A is the answer. Very good, guys. Very good. Next. A 46-year-old female had a previous biopsy that indicated positive malignant margins anteriorly. On the right side of her neck, a zero point 0.5 centimeter margin was drawn out and a 50 blade scalpel was used for full excision of an 8 centimeter lesion. Layered closure was performed after the removal. The specimen was sent for permanent histopathologic examination. So, what are the CPT code for this procedure? Ready, correct answer. Previous question answer is option A. Very good. Yes, everyone. Akash, Venu, Reddy. Correct answer, guys. Very good. Next one. A 45-year-old male is gone to donate his kidney to his son. So operating ports were placed in a standard position and the scope was inserted. Dissection of the renal artery and vein was performed, isolating the kidney. The kidney was suspended only by the renal artery and the vein as well as ureter. A stapler was used to divide the vein just above the aorta and three clips across the ureter extracting the kidney. So this was placed on ice and sent to the recipient room. The correct CPD code is Rasna Akash. Your answer is correct. Yes, Reddy also right answer. B 50547 is the correct answer. Very good, guys. Very good. Okay, next one. A 16-year-old male baby is in the OR for a repeat circumcision. Actually, this area of code is very important. Circumcision related code is very, very important. Nowadays, it's repeatedly asking. You can expect you can expect this question as in your CPC examination, guys. Okay. Circumcision due to redundant of foreskin that forced circumferential scarring from the original circumcision. Anesthetic was injected and an incision was made at the base of the foreskin. Foreskin was pulled back and excess foreskin was taken off and two row skin surfaces were sutured together to create a circumferential anastomosis. Select the appropriate code for this surgery. Rasna, Akash. What about others? Yeah, well, correct answer, guys. Everyone, correct answer. Mohini, no, no, no. Actually, C is the answer here. Hmm? Rasna, Akash, Venu, correct answer, guys. A 5-year-old female has a history of post void dribbling. She was found to have extensive labial adhesions which have been unresponsive to topical medical management. She is brought to the operating suite in a supine position. Under general anesthesia, the labia majora is retracted and the granulating chronic adhesion were incised midline both anteriorly and posteriorly. So adherent granulation tissue was excised on either side. So what code would be used for this procedure? Okay, correct guys. Both of you, Rasna and Akash. 56441 correct answer. What about others? Please check the question. Ready, correct answer. Next. Rasna. Okay, see, okay. What about others code? Akash, correct answer. Mohini, Rasna, everyone, correct answer. Super. Nice. Let me take another question. The patient is a 73-year-old gentleman who was noted to have a progressive jail instability over the past several months. Magnetic resonance imaging demonstrated a ventriculomegaly. It was recommended that the patient proceed forward with right frontal ventriculoperitoneal shunt placement with Cotman programmable valve. So, what is the correct code for this surgery? Yes, Akash, Rasna, Mohini, correct answer, guys. Very good. Next, what's the CBD code for the decompression of the median nerve found in the space in the wrist on the palmar side? Yes. Yes. Correct answer, guys. Rasna, Mohini. Mohini, no, no, no. Agash, correct. Okay, C, correct answer. Okay. Next, a 2-year-old male has a chalcine on both upper and lower eyelid of the right eye. He was placed under general anesthesia with a 11 blade. The chalcine was incised and a small curative was then used to retrieve any granulomatous material on both legs. So, what CPD code should be used for this procedure? So, guys, already I uploaded my giveaway winners in my YouTube channel. So, just go through the video. Actually, I selected three students. I'm so much excited to announce that because I got three students. Finally I selected three students. One from Jidin, next Christina and Deepthi. So these are the three milestones where I got. Okay. So guys, stay tuned for next giveaway. Thank you, Akash. Yeah, Akash correct answer, Rasna correct answer. Same time, Mohini also right answer. Okay. Yeah, next one. Actually, this is E&M code also. E&M plus ICD. An 18-year-old patient is returning to the gynecologist office for a pessary cleaning. So patient offers no complaints. The nurse removes the clean and cleans the pessary. Vagina is wrapped with the petadine and pessary replaced for F per U in 4 months. So what's CPD and ICD Tensim code reported for this service? Answer B, yeah, correct answer. 99211, comma, is it 46.89? Very good, Akash Rasna. Patient was in the ER. complaining for constipation with nausea and vomiting when taking Sovirax of the for his herb zoster and Percocet for chronic pain. His primary care physician came to the ER and admitted him to hospital for intravenous therapy and management of this problem. So what is the level of number of complexity of the problem addressed at the encounter?